Hi, my name is Justin Kaplan, and today my teammate Jack Hart and I are going to be talking about AI rapid miner models and their use to predict lung cancer. So, in this presentation, we're going to be talking about first the importance of the data of lung cancer and why it's important. Our second topic will be our first model, which was our decision tree model. Our third topic will be our second model, which was using neural networks and deep learning. Our fourth topic will be who this data impacts, and the fifth topic will be the importance and takeaways from our analyst. Lung cancer in America is a very important issue. It's the leading cause of mortality among cancers. Lung cancer deaths are projected to almost double in the next 20 years, which is an insane growth rate. This is largely because of smoking, vaping, and pollution. Also, ever since COVID, there's been a decrease in nationwide physician visits, which means the amount of lung cancer screening is going down, and also the increasing financial barriers to healthcare and doctor's appointments. As you can see on the right, 13% of new cancers begin in the lung. Around 230,000 adults are diagnosed each year. 60% of 5-year survival rates, which is not great. And also 80% of lung cancer deaths are smoking related, which we will get to later. So our first model is the decision tree. We use this in a data set among people that had been diagnosed with lung cancer in order to try to find some patterns and habits that may have been contributing to it. So we found that alcohol consumption, anxiety, age, and the presence of a chronic illness were large factors in this. This could potentially mean that these are contributing to lung cancer, or if these are just coincidences. And then also model two, we use deep learning to try to predict if any given patient had lung cancer. As you can see on the right, we have a title lung cancer, and we also have prediction true and prediction false. And then we also have confidence true and confidence false. This is basically the percentage of likelihood that each patient falls into that outcome. So this was being used to try to predict the combination of indicators and how they were relating to each person.
Using RapidMiner's AutoModel tool, we were able to determine the weight independent variables had on predicting the dependent variable. In this case, our independent variables were symptoms such as difficulty swallowing, coughing up blood, and our dependent variable was the risk someone has of developing lung cancer from low to high. As you can see in our deep learning simulator, if you increase chest pain, clubbing of fingernails, or dry cough, the chances of someone developing lung cancer increase. If you decrease those, it decreases. From our findings, one of the big things we'd like to see is an increase of people who are eligible to be screened for lung cancer. Only 20% of eligible adults underwent a lung cancer screening in 2024, with eligible adults being anyone from ages 50 to 80 with a 20-year long history of smoking. And as we saw in previous slides, there's a lot more factors that go into someone's risk of developing lung cancer. So increasing this 20% figure just for those eligible will exponentially increase life expectancy and deaths prevented, and expanding what makes someone eligible could also see a huge impact. We've identified three major groups we expect to be impacted by these findings. Firstly, the healthcare industry. As AI prediction models continue to improve and as access to them continues to get more prevalent, we hope healthcare professionals will use them to make more accurate and quicker diagnoses, as well as using them to call out potential hazards or factors in someone's daily routine that could make them more at risk of developing lung cancer, but not only that, but other diseases as well. We also see the insurance industry to have a major role in this, as more people become eligible for screening for lung cancer. Obviously, that will have a huge impact on how the industry approaches being able to give everyone access. Will they be able to? Does it require government policy change for that? There's a lot of moving factors into that, as well as like on the economic side. And for the general population, me and you, how does this impact our daily routine? If we have access to this information, if it's publicly available, we hope we can make better decisions to try and minimize our risk of potentially developing cancer or developing any disease, really. Having this data widely available can obviously make a huge change in how we approach our daily life.